Breaking news on the COVID-19 crisis in Ontario and an urgent call made public literally 2 minutes ago by more than 200 doctors and researchers for increased measures to address what they describe as a humanitarian crisis in long-term care in the province. In an open letter to the Doug Ford government, the group lays out a series of recommendations that it wants to see implemented. Michael Serapio is going to lead off our coverage. Michael, we're going to talk to the doctor who's behind this letter, but to set this up, why don't you bring us more in terms of what it says? This is Doctors for Justice in Long-Term Care.
Absolutely, and this is a direct result of what we saw in the first wave, Heather. As we know that the vast majority of deaths in this country due to the pandemic was in long-term care homes. And in Ontario, we had the government essentially promising to build an iron ring to protect vulnerable residents. But according to this new group of doctors, well, they say that promise has turned out to be at this point nothing more than empty words, which is why these 215 Ontario doctors and researchers are forming this group that as you said, Doctors for Justice in Long-Term Care, saying quite loudly that lives are being lost needlessly. Lost because they say the Ford government has been at best reactionary and piecemeal to the crisis in long-term care homes. And while promising to protect the vulnerable, the Ford government has instead, they say, ignored the advice of its own independent commission in the wake of the first wave deaths. And right now, we've already recorded more than 1,500 Ontarians living in long-term care having lost their lives in the second wave so far. 596 people dying in the first 3 weeks of 2021 alone. Take a listen to a doctor who works inside the Roberta Place facility in Barrie, Ontario. This is where just about every resident has now been infected with COVID-19. A third of the residents have died in just a matter of weeks. It just underlines the crisis that's now being faced in these LTC facilities right across the province.
The sense of loss every day is just really extraordinary. I mean, the staff don't have time to grieve, and we've had a relationship with these patients for some of them for years. So it's challenging for sure. It's really tested a lot emotionally and physically and mentally for a lot of us.
And important to note here, 41% of long-term care facilities in Ontario right now are in the midst of an outbreak. Heather, a situation with Doctors for Justice in Long-Term Care say is a direct result of the inaction of the Ford government in Ontario.
All of this to draw attention to the issue, to get the Ontario government to respond. Michael, how particularly would this group like the response to go?
Well, take a look at some of the recommendations. Many here. First and foremost, they want to see an end to for-profit long-term care facilities, noting that these private facilities have had the worst outcomes during this pandemic. Second, they want more staff, legislating a minimum 4 hours of direct hands-on care, setting a pay standard for staff consistent with a hospital sector in Ontario. They also want to ensure at least 70% of staff are full-time, allow essential family caregivers access to their loved ones as they are essential in the care of those in these homes. They also want to ensure formal partnerships with hospitals and a few other ones here, Heather, as well. They also want to be able to call in the military when needed to these long-term care facilities. They want the acceleration in vaccine rollouts for the residents and the workers and family caregivers in these LTC facilities. And one big one here, they also want to give hospital staff the authority to enter any long-term care home in the province of Ontario without having to get the permission of private companies who may actually own those facilities, Heather.
Michael, thank you very much. Beginning our conversation there with the details, as I mentioned, just off embargo 5 minutes ago at 7 o'clock Eastern. Dr. Amit Arya is a palliative care physician. He's the co-founder of the group that Michael is just talking about, Doctors for Justice in Long-Term Care. He is in Mississauga, Ontario. Dr. Arya, thank you for joining in. Just as we're able to talk about this, delighted that you're available to give us some further detail. Good morning.
Good morning, Heather.
This letter warns of a humanitarian crisis. Can you describe it in a little bit more detail? What are you seeing presently in the province?
Yeah, so I mean, I've worked frontline, Heather, in long-term care facilities with large-scale COVID-19 outbreaks. I mean, I've seen, the devastation that this virus brings to people who live in long-term care and people who work in long-term care. I've seen people dying from this virus, and I've actually been the first person calling their families and consoling them, to tell them about what was happening. I mean, we're in a situation which absolutely is a humanitarian crisis. I mean, as was already mentioned, 1,500 people or over 1,500 people have died so far from COVID-19 in long-term care facilities in the second wave alone. I mean, the weekly average of deaths due to COVID-19 in long-term care, last I checked, was at 171, which means that really we're having 1 death per hour due to COVID-19 in long-term care in Ontario. If that is not an emergency, what is? And that's why I'm joining together with my colleagues, to sign this open letter as part of Doctors for Justice in long-term care.
And more than 200 doctors now joining you in this call. As you tell us about the deaths, I mean, that's a staggering number, 1 death per hour. There are deaths. Is it fair to call them, Dr. Arya, needless deaths?
Yeah, I mean, absolutely. I mean, the same factors that were in evidence that led to the spread of COVID-19 in wave 1 are still in evidence today in wave 2. So really, this is a matter of political will. When we talk about this as an emergency, I mean, what that means is that we have to take action today. And another thing that I want to highlight, Heather, is that, well, these numbers don't illustrate or don't tell us about the suffering that we're really seeing in these long-term care facilities. There are people who are dying not just of COVID-19, but also from neglect, people who are dying from dehydration and hunger due to a staffing crisis that the government has not addressed. So really, when we talk about this, when we talk about our seniors and we say that we value them, we talk about an iron ring, that means we have to do everything we can, get all hands on deck, and take action today.
But if we think back to the first wave, Dr. Arya, this issue was really one of the most important that we talked about. And the calls were so loud and coming from all over to reform the system, how we're not protecting the most vulnerable, how unconscionable that is. How is it that we're right back in the same situation and in many cases worse again?
Yeah, I mean, I think our whole group, Doctors for Justice in long-term care, is looking for those answers. I mean, we're at a point where we've just absolutely had enough. We've seen so much devastation happening in our long-term care facilities, and we're at a situation where, number one, we also need full transparency and accountability from long-term care homes. We need to make sure that, any interventions that happen very early on at the first sign of trouble, because the threshold for intervention clearly should be very low. We need to have these emergency response teams, whether they're from hospitals or community-based health workers, ready to step in to help in a crisis, and if needed, call in the military. I mean, this is all an issue of political will, and I call upon the Ontario government to take action today and treat this like the emergency and humanitarian crisis that it is.
It's interesting. We have had voices on this program and certainly on our network from people like you who have made these points strongly before, as you are right now. Why do you think the government is going to heed it this time when perhaps it hasn't to the degree you'd like in the past?
Well, I guess, we can say there's strength in numbers. I mean, we have, about 250 people. Many of these people are leading, physicians in the medical community, expert researchers who have years and years of expertise working on long-term care and seniors care, social justice advocates, union representatives who have all come together to call upon the Ontario government to take action, today. I really hope that they will. And a reminder that the people that we are losing in these long-term care facilities are not just numbers. Sometimes at this point, we may have become numb hearing all these statistics and this data coming out day after day, and we're all tired, needless to say. But these are real human beings. These are people's parents and grandparents. These are actually the people who built the very society that we cherish. And now it's time for us to give back. If we say that we wouldn't allow this crisis to happen again, and we're in it now, that means we have to act today. And that's really what Doctors for Justice in long-term care is about.
And Dr. Arya, just before I let you go, this is obviously a concerted message or a strong message to the Ontario government, but certainly problems in long-term care homes are not restricted to Ontario. Is this something that you might be working with other doctors on a nationwide basis to continue to make these points in a similar manner with other colleagues?
Yeah, so for now, our open letter is definitely directed at the Ontario government alone, where we're in the middle of a humanitarian crisis. But absolutely, we know that across the country, we have this fragmented system of long-term care, which is heavily dependent on private for-profit operators. There needs to be a big overhaul in terms of how we look after people who live in these long-term care facilities, starting with addressing the staffing crisis and removing for-profit private operators out of the system. system. We're in this point in time where we've lost well over 10,000 people due to COVID-19 in long-term care, and that's 70% of all COVID-19 deaths that have occurred in Canada. So we're having this conversation about national standards, and really now is the time for everybody to put their political differences aside, take action immediately, and really redesign this broken system. I'm very hopeful that 2021 will be that year.